I just wanted to introduce myself in case any of you did not know who I was. My name is Rubina, and I'm an academic recruiter with ADMI, which is Aspen Dental Management, Inc. We are the support organization for Aspen Dental, which is a DSO, a dental support organization in which we have 800 dental offices or over 800 dental offices, and we're here to support our dentists, just like Dr. Vanderbaan over here, and just have them focus on patients and clinical care. So before we begin, I'm just going to go over a few things. There's a question and answer little box on the bottom, so feel free to type in your questions there, and I will click on them and kind of be just the moderator. So the doctor can answer it, and I will occasionally be looking over here on the second screen because I'm going to post the question and answer box over there. Plus there are some questions you guys submitted prior to that I will be referencing as well. If there are any questions you want to ask privately, you guys all have my email, or you can ask it in this question and answer box and just indicate that you want to have that answered privately, and I can email you afterwards or connect you with Dr. Vanderbaan, and you guys can communicate on what those questions are. So we will begin the session, and I will have Dr. Mitchell Vanderbaan introduce himself.
Well, hi, everybody. You can call me Mitch. Don't say Mitchell. I sound like I'm in trouble for my mother. So I can give you a little backdrop about who I am and kind of how I ended up in Aspen. I am from Grand Rapids, Michigan, so I'm born and raised in Michigan. Grew up my whole life here on the west side of the state. For those of you who are from, is everybody here from Michigan? Is that true? Or
I think we have a few, Ohio for sure, but mostly Michigan.
Oh, yeah. We can't talk to Ohio, but everybody else that'd be fine. No, anyway, so I'm from the west side and born and raised here. Went to undergrad here, and then applied to dental school and got into Detroit Mercy. So for anyone at Detroit, I have been in your shoes, although I think things are a little different now than when I went. So I graduated in 2014 from UDM, and did not start with Aspen then. At that time, I had actually signed up to do a military scholarship. So I was an Army dentist. So signed up for dental school and the Army at like age 22 and figured it out. But so I ended up going to the Army for 5 years. So I did a 1 year AEGD through the military, and I was pretty much set on, I was going to be an oral surgeon. And so that was the track that I was going to do. But then through various things, I just decided that I didn't want to owe the Army probably a decade more of commitment. So I got out in 2019 and kind of landed at Aspen. So that's kind of my backdrop and kind of where, you know, what led me to here.
Wonderful. Thank you for that. So I guess going along with your journey, what options did you look into coming out of dental school, and why did you choose Aspen Dental in the end? I know you went to the military, but just where did Aspen come into play for you?
Good question. Well, I mean, I probably, and for anyone who, you know, obviously is considering the military, that's a whole different tangent. I can give you any information. So anyone afterwards, if they want questions answered, that's fine. But different story than most of my classmates. Obviously, most people graduate and they go right into the private sector, and that's their journey, right? And so the Army is very different. It's almost like a DSO in the sense of it's kind of not, but it's not private practice. It's like this weird side thing where you're part of this whole community of people that are, you know, service members and civilians. And then there's all this, you know, this stuff. So I have a little different journey maybe than the average student. But when I decided I was getting out, that was kind of like me graduating all over again, because I had been used to something for 5 years and never practiced outside of that other than talking to classmates and kind of what you guys are doing now by talking to people who have kind of been a little further down the road in their career. And so I didn't know what I wanted. I mean, I still kind of am trying to figure out, you know, what does this crazy dental journey for me look like? So I looked at private practices. I looked at, you know, where do I want to live? Aspen was not the first thing on my list just because I didn't know anything really about it and didn't have any contacts right away. So I was looking at private practice, trying to figure out how I could move back to Michigan. I was living in Washington at the time, and just trying to figure out how to get back, you know, home to Grand Rapids, which is kind of where I ended up wanting to go. And so through a process of just a lot of just broken, fallen through opportunities where you're like, oh, this doc thinks he might need somebody. Oh, that's gone. He doesn't need anybody. Or, oh, this person over here, might need somebody. It wasn't working. And so finally I got in contact with, I don't remember exactly how his name came up, but I got in touch with Dr. Miller, who is what we call a POP, which he's an owner and owns multiple practices on the West Side. And so we started a dialogue and kind of explained my situation. And with the Army, you're like, I had a date set. And so I did not have a job lined up, and, kind of like graduation. And I'm like, okay, I need to find something. And so Aspen popped up as a potential opportunity. I'm like, holy crap, like this might be great. And it seems like a really great opportunity to work for Dr. Miller, who I kind of connected with pretty well. And so it all just it worked out really well. I didn't plan it that way, but it worked out great. And so I've been with Aspen now for over a year, 16 months, I think. So.
Wonderful. So going along with, like, I guess your perspective, being a new grad, coming, even though you weren't a new grad, but you felt that feeling of being a new grad, what did it feel like, or what did it look like as a new grad or a almost new dentist, even though you were not a new dentist, but starting with Aspen? Like, did you have a good experience? Did you feel supported? How
Yeah.
exactly was that?
I mean, I connect with a lot of new grads in the sense of, in terms of dentistry, like, and most dentists will probably agree, or most students who are going through dental school, they teach you very well how to do dentistry, right? You're pretty well prepared for the most part. I mean, there's things that we're always learning, but I was coming from a place of like, hey, I think I want to own my own practice, right? Or at least at that time, that's kind of what I was thinking. I'm like, I don't know the first thing about running a dental business. I've run a clinic in the Army, but that is totally different from the outside world. And so I think I was on this quest of like, how do I gain the most knowledge in terms of the business side and running a practice versus the skills? Because the skills I had pretty well, I feel like I was pretty confident. I had done dentistry for 5 years and, did extra training, so post-grad education, and felt very confident in the dentistry part, but not so much in the, how do I get people to, buy dentistry? Because in the Army, there's money is not an issue. You don't have to worry about, oh, an implant costs this much, or, oh, I wasn't seeing a lot of dentures, which Aspen is a little different, right? But in the Army, everyone's pretty healthy, and maybe they need a crown, some stuff. But money was never an issue. And so I didn't really have to run a practice with that in mind.
Right.
And so Aspen, what drew me into them is, you've done this, they've done it, 800 times and opened 800 practices, over 800 now. And so they have a good support system alongside of the clinical, where you have this whole thing, which you can probably, tell them more about ADMI and what that is, but this business component to it, where I felt like I was from the beginning, I had a safety net to ask questions and bounce things off. Whereas you buy a practice and you're on your own right away. I mean, that's good and bad, but you don't really have a whole lot of resources unless mom and dad are a dentist, or somebody, you're kind of sink or swim. And so this was kind of a landing pad where I felt like, well, I don't really know what the next step for me is, but this seems like, a good opportunity to learn some of the business sides of things and really see kind of where I wanted to, where my career was headed, because I didn't really know.
Definitely awesome. So going along with what Dr. Vanderbaan had said with ADMI, we're the support organization with Aspen Dental. So we have like a whole marketing team, we have an HR team, we have a business development team, we have directors and division vice presidents and regional managers, just all there to assist the doctor in succeeding, basically. So the doctors don't have to worry about trying to find patients. They don't have to worry about, how the insurances are going to be billed. We're here to figure all that kind of stuff out. So again, the doctors can just focus on patient care. So it's a really nice aspect of just having that support and not having to wonder, like, what else do I have to do, which is kind of a lot of stuff being in a private practice or just being on your own. Even as an owner of Aspen Dental, you still have that support, but it's, it's your office. So it just creates more ownership and whatnot, but we're still here to partner with you to help with anything you may need. So someone just asked, when it comes to treatment planning, do you have treatment plan autonomy as an associate, or you're a lead dentist, correct?
Yeah, I can
Yeah.
explain. So
Yeah.
I guess technically there's associates, and maybe this isn't the point of it, like breaking down each little
No, yeah, go ahead.
title, but I'm assuming I've never been an associate for Aspen. I've been what they call a managing clinical director, which basically is called MCD, which is the acronym for it. But I started immediately that role, and basically what the job of an MCD is basically you're running a clinic, or you're basically the lead point doctor at a clinic. So, for example, in the POP, or the owner system that I work in, there's 5 clinics, and Dr. Miller owns all 5, but he mainly works out of one. And so he was looking for somebody to fulfill his Grand Rapids location and basically work there. So from pretty much from my onboarding, I was just kind of off on my own, and it was fine. It was great. I loved it. I also wasn't a new grad, so maybe a little different in the sense where I didn't feel like I needed somebody over my shoulder right away. And so maybe coming out of school, maybe people will feel different. There's definitely different roles, and part of it is seeing what's available. Just like if you're applying for any job or position, you got to kind of see what's out there. But Aspen has associateships, which you'll probably be working with another doctor in your same clinic, or the managing role, which basically I run a clinic. Even though I'm not an owner, I run the clinic like I was, and so yes, I do have kind of full control as to how I treatment plan. Now there are a lot of resources and a lot of things, and I can get into that later about what makes Aspen pretty special is the amount of CE and the time they put into, just giving their doctors the tools. Because I had even being well trained, there's a lot of cool things that I got to do even in the first year at Aspen that you might not be able to get unless you're paying tens of thousands of dollars in CE to go do some of these courses.
Wonderful. So you have full autonomy, treatment plan autonomy. What happens? Have you had a situation where you have an associate that you're training under you?
I do not yet. I actually, that's the next step is I kind of came to a clinic that was, I don't want to say down and out, but it was definitely a lot of transition before me, just due to geographical. People were moving in and out, and Dr. Miller was looking for somebody. Again, I'm from Grand Rapids, so maybe a little different than people. The doctors before me were never local, so they were kind of there with the intent to probably leave. So in terms of the treatment planning and kind of my position, I have not worked with anybody else, but they're looking to bring on an associate. So I think, and maybe you can explain, the Aspen model is ultimately to have 2 docs in every practice. So that's really when it runs at its best.
Right. So a lot of our offices will have an associate and a lead dentist, an MCD, just like Dr. Vanderbaan. And so a lot of the associates will be often, not all the time, but often are new grads. And new grads do need mentorship. And so Dr. Vanderbaan would act as that mentor for you. Some offices have a 4-week program where you're leaving the office and going to Chicago or Syracuse for training, but then some just do real-time training with a doctor that's already there, and that doctor's your mentor, and they're assisting you with trying to understand like how your treatment plans are going to work, not telling you what your treatment plans are going to be, but assisting you with timing. And if you think you need 3 hours, take the 3 hours, but as time progresses, you're not getting your professor checking or clin checking. I'm sure you can explain all that stuff, but they're there. The lead dentist, the MCD, is there to help you and mentor you until you feel ready enough to just take on patients and maybe see some new patients here and there, and plan treatment plans, and feel that confidence. So no one wants to throw you into the wolves or anything like that. It's all here to help you grow, and your growth is important to us because then everyone grows as an organization. So yeah. So what are you currently enjoying about dentistry? Little fun question.
What am I currently enjoying?
Yeah.
I would say the most recent exciting thing, and again, maybe this comes back to what I recently talked about with the ability for Aspen to really invest in their doctors, and whether you're there for a year or 5 years, a whole career, I don't think they care as much as about what your goals are. So the cool thing about Aspen is they will invest in you regardless. Like they're they're established enough where they feel like, regardless of kind of what your ultimate goals are, which is kind of cool because nothing's ever really forced, right? It's kind of like this relationship where they are very big, like it's a little bit daunting when you're like, holy cow, there's 800 offices. Like, am I just going to be the smallest ring in this totem pole, but it's, from going to Chicago or going to these different things in terms of training. So like there's one for Invisalign called Lift. There's one for just how to run a practice kind of in the Aspen model. So there's different models and different techniques they found that have worked really well. So like in terms of treatment planning, you really have full control over whatever you want to do. But at the same time, there are backed, studies and information that Aspen has done to figure out, hey, this is the optimum, or this is kind of the goal of trying to increase your speed or, manage a smart schedule where you don't feel like you're pulling your hair out all the time because you've got like, 10 crown preps in 2 hours or whatever it is. So they're very good at supporting you and kind of saying like, hey, doc, like everything's, measured. So like all the metrics and the feedback and the data is really cool. But to get back to your original question, which was what am I excited about? They're rolling out 3D imaging and CBCT in every office, or trying to get it installed in every office. Minus COVID, it probably would have been done already. But in terms of digital treatment planning for implants and, things like all on fours and like all this stuff that I got a little taste of in the Army, and being able to roll out digital dentistry in the capacity they are is pretty sweet.
Awesome. And I know you talked about earlier about like CEs and stuff. Can you elaborate on that? Like, can you choose which CE courses to take, such as implants, like you mentioned, or, and also does Aspen pay for it, or does it just depend on the type of CE?
Totally. CE, obviously in general, there are, I guess 2 different types, right? There are CEs that you might want to go that are not affiliated with Aspen. I have not really, because Aspen's provided me quite a lot, I haven't really needed to go outside of what they offer in-house, which is pretty cool. And they have a sweet facility in Chicago that I've gone to twice. So one was for a 2-day Invisalign course, and then the second one was for more of a business managing course, and then implants is kind of the next thing that's up. So they're rolling out a lot of stuff, and they have a lot of support from leading professionals in their field in terms of specialists and different things. So I don't think you really get that a whole lot of other places other than maybe the Army and the military because of how they are connected. I feel like they're very similar in the fact that you have a pretty small community inside of Aspen where you can work with other doctors, and it really is a culture and community inside of one in dentistry in general. So I think that part is very similar to the Army, where you have a lot of resources at your fingertips where you might not if you're just, like I said, on your own or just in a solo private practice.
Right. So you did speak about like the community and stuff. Do you have a mentor? Can you reach them easily? Are they part of Aspen? Are they easy to access?
Yeah, I definitely have a few different dental mentors just in my life, but Dr. Miller, the owner of the 5 practices, in the Grand Rapids area and on the west side, he's been a mentor to me, not only just in Aspen, but he's a little bit older than me, has been doing this a little bit longer, and so getting that mentorship has been great. And then on a more bigger scale, from things like Invisalign, like I didn't do any Invisalign before I got out of the Army, just because unfortunately the military doesn't care how straight your teeth are, they just care that you can do your functions, right? So I didn't do any Invisalign. That was something I've always wanted to do, and within the first 3 months I had gone to the course and then started doing cases. And Dr. Galler, who has moved on from Aspen, but he was there and has been a mentor. And even, I would pretty talk to him on, every week I would talk to him about a case. And, you can message people on, WhatsApp or whatever, people are using, or text people. And so even the highest, the VPs of whatever they're in the company, you can talk to them and access them if you need them. So that's, you don't see that a whole lot. That's pretty cool.
Yeah, definitely. So when it comes to dentistry, I know we talked about what you enjoy. What do you find frustrating?
What do I find frustrating?
Yes.
I find it frustrating. I find selling people on what they need frustrating. Like having to feel like I have to convince people all the time of like, your tooth hurts, you don't need an antibiotic. What you need is a root canal, like so those aspects that really have nothing to do with Aspen or, it's just dentistry in
Yeah.
general. I mean, we're in a weird profession where people, half the time tell you they hate you when they sit down. They're like, I hate the dentist. And you're like, me? Or just, like, what did I do? Like the way I look, like,
Right.
but just those little, funny things about dentistry. I think probably every dentist will tell you, it's like, we have this weird dynamic relationship with people where we're always trying to win people over, even when we've never met before, even on a new patient exam. And this is the first time. And so trying to de-escalate situations and calm people's fears and stuff, I think it's fun, but it can also be very challenging when you're like, it's
Yeah.
clear, like,
Yeah.
you
Any
get a big
advice?
hole in your tooth, like that's bad.
We're also doing an iTero scan. Like we can really show you the picture, but no.
I want my teeth whiter. Okay, but what about, so yeah.
Um, any advice for dental students with all of that?
I was getting another call.
So,
Okay.
any advice for dental students with all of that? I'm sure they're like, they come out of school and they're just like, help, what do I do? Like any advice or just any advice in general for dental students?
Yeah, I mean, I have not figured it all out. This is my 6th year of dentistry, so I won't say I'm a pro, although I've done a lot of fun things in the field already. I would just say, one, you got to kind of laugh at yourself. And, I think really at the end of the day, like you want to create a culture, right, that, people want to come and be a part of it, whether it's a patient or it's a team member, right? If you are hating your job at work, people are going to see that. People are very good at picking up on little things like that. So I would just say that my advice is kind of like, do your best, treat people well, go with your gut. All of you guys are going to be trained well, especially the UDMers out there. I got to give a little shout out to them. I don't know if there's folks in the house, but you're trained well. I mean, you got to trust yourself and be confident. And I'm growing this beard because I have a baby face. So in the Army, everyone would ask me if I was 12 years old all the day. All these colonels would be like, these crusty old guys would be like, how old are you? And how long have you been doing this? And, so it's just, I don't know. I just think, we have it's a great profession to impact people very quickly. And so, my brother's in medicine and, he has to run all these tests. And for dentistry, it's very much a see a problem, fix a problem, and impact people in a short amount of time. And I think that's really cool. So, I guess my advice is don't take yourself too seriously and, just do your best, because there is no prep out there that's perfect. And when the patient's squirming around like a fish and, you're trying to do your best, like that's all you can do. You go home easy at night when you treat people the way you would want to be treated.
That's great advice. I'm surprised people talk about your face. You've got the mask. Now you've got like 3
Well, now,
masks.
yeah, 5 masks, right? So
You've got 10 shields. You've got everything, all the protective layers with COVID and everything. So a student just asked, do you have any suggestions on how to choose what office to work for? Because when it comes to interviewing, you really don't know if their working style is someone that would mesh with you, and you really don't get a sense of that until you actually work with them. So how did you figure it out? I know, you went through a lot of processes of
yeah,
figuring out Aspen, but like, how did you figure that out?
great question. I would say, I mean, you're never really going to know. I mean, you could even, I'm sure everyone's hit it off with somebody on a personal level, and then you like get into a clinical situation. You're like, whoa, that's totally different than how I would do it. Or, I think I got very lucky in the fact that I hit it off really well with the owner. And I also got put into a practice that was kind of in the area that I wanted to be, which is Grand Rapids, my hometown. And the timing of it worked out well, although I got hired like a week before my Army contract was up. So like the timing of it again was lucky. And had COVID happened a year ago, I don't know what would have happened, but I would just say, don't let that factor too much in your decision, because at the end of the day, like, I guess I'm kind of a guy that's like, there was a lot of things about the Army that were not fun. Like there was a lot of things that they made you do and different things, and like getting up super early and taking drug tests like at 3 a.m. because they're just randomized. Like there's a lot of things that if you just kind of go with it and make the best out of it, even if it's a situation where maybe you and the doctor that you start working with don't, connect personally, or maybe clinically you're a little different, like there are even things that where Dr. Miller comes and works with me a day and we treat cases differently, but we're still on the same team, like at the end of the day, it's a team thing. So you'll find that at Aspen, like whether, it's practice X or practice Y, maybe there are different owners or maybe there is no owner. Um, you pretty much are given the keys to kind of do things your way within reason. I wouldn't say that there's anyone watching over your shoulder, but the benefit is like if you have a question or like you're like, man, what would I do on this case? This is a tough case. Having the resources and the ability to talk to other doctors is, I really enjoy it because like, again, if you're on your own, you don't know what you don't know. And usually in the Aspen thing, if the one doc doesn't know, you can go right up the chain and figure out somebody who might have that answer for you, which is pretty cool.
Definitely. So there's resources regardless. If
Totally.
if you don't mesh well, it still can work.
It totally can.
Yeah.
And, again, I think that all comes down to kind of personality and like, if you're not happy or if you don't want it to work, it's not going to work. If you feel like, okay, there might be some things that maybe I do different, like you can still, do it in a way where, stick to your guns. I don't think I've ever changed treatment because someone else told me to. Like I kind of do it the way I want to do it. But there are times where I've like learned something from somebody else and like, oh crap. And then you go back and you're like, I'm going to change that treatment plan that I did this way because of this that I just learned. So, you can't also be the guy who's so egotistical that you can't take advice from people. Cause then you're it shows to you where you're like, if you think you know it all, you probably don't know it all.
Right. So it's for the better always.
Totally.
Awesome. I just had a student ask, when you treatment plan, is there a front desk person or a representative who handles going over the insurance and financial breakdown of what the patient has to pay, or do you have to do that?
Great question. I don't deal with money, and I tell people that every day. I'm like, how much is this, doc? But doc, how much is this? But how much is it? I'm like, I don't know. Like I literally tell people, I'm like, I'm not smart enough to remember all these insurances. Like we got a team for that. So Aspen does a great job at having a front desk team and an office manager that consult with you. And the key that I found is really successful is being good at handoffs. And so we can maybe talk. I mean, we don't have to get in the minutia. And you guys, I can give my phone number to anybody who wants to call me up and text me anytime after this. And maybe those are some questions too, where we can get into the flow of how a day looks. But yeah, I mean, I have a team up front that pretty much does all the consulting, all the insurance, so basically I put in the plan and then I hand the patient off to the front desk team who will go over that plan with them and look at all their, their metrics of, do they have insurance? And if so, what is their obligation and all that stuff. So Aspen's pretty good at,
That's awesome.
walking the patient from start to finish through what we call handoffs, which are, really important.
Yeah, definitely. Also, besides giving out your number, there's opportunities to shadow. So, if you're in the Grand Rapids area, you could just shadow him day of, it's something we can definitely work on. So it's a great thing with Aspen, especially if you're a fourth year and you really want to get a feel of what you're doing. Like, am I going into private practice? Am I doing a DSO? Check out every avenue because you might find that you like XYZ and it might be just because you shadowed or asked the right question. So we definitely give that opportunity. And I think Dr. Vanderbaan would be open to, allowing a shadow in his office and
absolutely
just mentoring for the day. So thank you for that. If I just volunteered, thank you. Another question, do you do all procedures or just some procedures?
I do everything. I pretty much do everything. There are some things that, so maybe another kind of, I'll keep it brief, but the way the Aspen model works is a lot of times we'll have a traveling specialist too. So for example, like if there are third molars that I just don't want to touch, or the patient is super anxious and needs to be sedated, or, for example, endo, I personally don't do a lot of endo. Just because I don't have the time to do it. And I can explain kind of the Aspen flow or the Aspen model, but I see a lot of people. I mean, in the Army, I was probably seeing 12 people a day, 12 to 15 people a day, probably triple that at Aspen, maybe more. Not all of it's, obviously procedures every day, but from denture, adjustments to, denture steps to, post-operative healing checks or, limited exams, or I see a lot of people probably 35 to 50 people a day. So it's the flow is different than dental school, right? And it takes a little while to get comfortable with that. But when you're seeing a lot of people and giving a lot of people care, it's pretty rewarding. So I would say, yeah, I mean, it's everyone's going to have a flow in their career where you should not be worried about your pace or your skill and different things because that will come with time. But getting right fundamentals is really important.
So going along with like seeing 25, 30 patients, I'm sure a lot of dental students hearing this right now are like,
Totally.
what? Like,
Uh,
what? Can you just elaborate a little bit more on like, what does that mean? You're seeing 30 to 25 to 30 patients?
Yeah, I mean, I guess in dental school, you don't really see a dental clinic run a highly effective team is front desk. It's the hygienist. It's me doing procedures, which is I would say probably. I mean, I work a lot and I do a lot of procedures, but that's not probably the main. I mean, my role as a clinical director is to obviously oversee the flow of the whole team, right? So it's just me. So again, it's pretty easy, but if you were an associate, you may not necessarily have the same roles and responsibilities as someone who's running an entire clinic. But I have to deal with staffing issues, or I have to deal with like little things in the day to try and increase production or different things. So I deal with a lot of non-clinical aspects too. But in terms of procedures, back to the original question, I do everything. I do extractions. I do not do implants just because we don't have the 3D imaging yet or the implant systems, but I did them in the Army. So I do implants, Invisalign, I mean, crown and bridge, dentures, which I had not, again, done any in the Army. So that was fun to dust the old cobwebs off a little bit. But yeah, you can pretty much do and tailor the practice to however you want it.
And then with dentures, like, are you sitting there like in dental school, actually putting the teeth together or?
No, we have a in-house dental lab, which is pretty cool. I mean, it's a model. I think Aspen is probably one of the only, or one of the spearheads in kind of having an on-site dental lab, and it's pretty great. I mean, it's good and bad. I mean, it's great because you can get people's dentures turned around quickly. It's bad because Grandma Jenny, who's 90 years old and broke her denture 5 times, knows that she can always come in and get it repaired the same day. So that's gonna be a little frustrating. But no, it's great having them on site. And so I'm not setting teeth. I'm not doing that. But you are obviously overseeing all the denture steps from initial impressions to wax bites, wax tries, and then delivery appointments. So yeah, it's not anything that you haven't learned. You'll find that all the knowledge is in there somewhere. You just got to kind of pull it to the surface.
Awesome. Someone just asked about residency. So you did say you had a little bit of a GPR in the Army, and then you started working. They asked, should I go into residency? And I know for you it doesn't apply, but did you feel like Aspen maybe could have given you enough support not to go into residency?
Totally. I think had I joined Aspen right out of dental school, I mean, again, having the resources and the backing that they do is it's a pretty great safety net. And I don't want to use the term safety net like when you're licensed and you pass your boards and you're off. I mean, you're ready to go. Doesn't mean that you feel confident in yourself, right? You're like, holy crap, I'm out treating real people without a professor. Like, what is going on? But anyway, I think that Aspen offers a lot of opportunity for learning. It offers a lot of opportunity for dialogue between doctors, where it would be similar to residency. Now, I have my own journey, so it's like I can't tell you to go to residency or not to. I felt like I did a lot at UDM, but at the same time, I also had career goals of like I'm going to be a surgeon, and so when I applied to oral surgery, I didn't get in my first year. I was waitlisted, and so I'm like I'm going to do this residency kind of as a resume booster, but at the same time, man, I got a ton. And again, the Army's different because money's no object. So like I did so much stuff in that one year because I felt like that was the next step for me. I'm
Right.
glad I did it. I feel like I learned a lot there too, where I'm still using techniques I learned in my residency. So more training is never bad, right? I mean, going to residency, no one's ever going to say like bad idea. But it's kind of what your goals are. I mean, if you feel pretty confident in your skills, I don't think you need one. but at the same time,
Yeah.
it's like having those cases. I just feel like in dental school, I graduated with 5 canals of endo. 5, like that's like 1 molar plus one, like plus 1 canal. So like, and then in the army, I did like 30 second molars that I'm like, I'm never doing endo again. Like, nope, done, so it's like, I definitely felt like the case wise, I didn't necessarily have the amount of cases to feel totally confident in everything I was doing. And so for me, residency was great, but Aspen's pretty comparable in terms of resources. Yeah, I would say, it's pretty good. It was probably not as, you won't get the same level of specialty cases right off the bat, probably, but you can always work towards, with you and your mentorship, your mentors or whatever, you can work towards kind of whatever avenue. If you want to do implants, like there's a whole program that they're laying out for, what you have to do to be part of that. And if you want to do endo, like you can structure your schedule depending on where you are based on that.
Right. No, that's amazing. Thank you. And I know you talked about like, your staff and having involvement with them. How involved are you with hiring the office staff, besides associates, but like hygienists, front desk, or even if your office does expand, associates?
Yeah, I mean, we have a regional, manager named Andrew who works for ADMI. So ADMI, again, is the more business support side of Aspen, which you kind of explained. So he is really in charge of bringing candidates to the clinic. And obviously me or Dr. Miller, who's the boss, really have the say. So, it's kind of my team, even though it's not my practice, they treat it as though it's mine. And so that's, I feel that, that ownership level of it, where I feel like, if I didn't like a team member or they're not working with the team, like it's not going to work. Right. And so, or if we like a candidate and they come in and they interview well and I'm like, yeah, she's awesome, let's hire her, so I think they ask my opinion on everything. Nothing goes beyond me or above my head or, behind my back. It's all up front. Say, Doc, what do you think? Andrew's,
Awesome.
good at bringing, people to the table, whether there's turnover or, change in schedule, or, and I know there's a question about COVID. Obviously that changed a bunch of stuff, but
Yeah.
yeah, I mean, I think, you're directly involved in the whole team, and, I think it has to be that way.
Right. Well, especially you'll be with the office staff like every single day too. So you definitely want to make sure you're working with someone that you enjoy
Absolutely.
working with. I know you haven't yet had an associate in the office, but can you give any like recommendations or insight on what doctors look for when it comes to hiring an associate, especially for new grads? Like, what do they need to know on presenting themselves or how they're supposed to be?
Yeah. I mean, I think, at the end of the day, what makes a good team member, like we're the team, the field of dentistry, and like, as you guys side of dentistry, you'll learn like it is a team effort, right? Like you can be the best doctor in the world, but if your front desk lady is, a grouch and doesn't treat people well, like it's going to end up blowing back in your face and you may not even see it. So like we get so focused on the clinical, like I got to cut this tooth, I got to focus on this, like not seeing around everything, right? You got to be in tune and aware of some of these things that you're not taught in dental school, of like, how what do good team members look like, right? You help each other out, like, I mean, yeah, there are times where I take out the trash in my office. I mean, I'm not above that, right? Like if there's a trash bin that's overflowing and my assistant's taking a bunch of full mouth x-rays for me and I'm like, I'm going to contribute and help out. And so I think just being a good team member, being humble, don't let your position in the office get to your head. I mean, I see a lot of dentists and their team hates them, or you hear like these horror stories of like, oh my gosh, don't talk to so-and-so, Dr. So-and-so. And it's like, I don't want that to be me. I don't know about you guys. I don't want anyone to be saying behind my back, I'm not there on Monday. And it's like, oh, thank goodness Dr. Mitch isn't here. Like, so like, I think what I would recommend is, be yourself. Don't be somebody you're not, but at the same time, approach dentistry with humility, because again, it's a hard business. Cutting teeth and working on people that are moving is hard, and people not liking you is hard, and trying to, do all those little things that we have to do daily. I think what owners are looking for are people that are, teachable, good team members, that have a positive attitude. I mean, attitude is everything. If you hate your job every day, it's not going to be fun,
Right.
like, And there are days that I love Aspen. And there are days that I'm like, okay, is Burger King hiring? Because I could flip burgers, you know, like, and that's dentistry. It's not Aspen. It's just dentistry, right? There's some days that are so rewarding, but then you get some of those patients that you're like, why do they keep coming back to just torment me? But, you know, when owners, you know, and Dr. Mill, you know, and maybe, you know, having, you know, some questions for owners might be good too, but, you know, I'm not in an ownership position, so I can only speak from what I know. But in terms of hiring, I mean, I feel like, you know, most candidates are qualified now. It's more of just kind of how are you going to fit into the team, right? I think that's really what they're looking for.
Definitely a good
Are
match.
you coachable and are you teachable? Because if you're not, like, again, if you're a know-it-all, like I'm a new grad, you know, I got my degree, like, look at me, I can do everything. You'll learn very quickly you don't know everything, you know, and there's a lot of smarter people out there that you're like, okay, I want to listen in on what he has to say.
Awesome. Yeah, definitely. Now I know you mentioned the COVID. Are you reading the questions? You're not supposed to read the questions.
No,
I'm
I'm
going
not
to read.
supposed to read them unless I
No, I'm just joking. But we did have a COVID question about how were you in the office affected by COVID? Did you feel like Aspen took care of your staff if your office was shut down?
Yeah, I can briefly, I mean, it was all a blur. I don't even know what happened, right? But we were closed for, I would say probably over a month and a half, probably 6 weeks or so when I wasn't actively full-time working. So we shut down in March like everybody did. And then there was about a good, I don't know, like I said, 5 or 6 weeks where I was not working. Then we started seeing emergencies only. And then in June 1st, we went back to work sort of full-time. So I felt like it was great. I mean, I feel like I didn't have any of the headaches that I would have if it was my practice and I was having to figure out where the money's going to go and, you know, how I'm going to pay for people and keep them on the payroll and stuff. So the benefit of an Aspen style organization is they can accept blows or crazy things that most companies cannot. I mean, they just have the size, which can be good and bad. I mean, the bigger a company gets, you worry about like, hey, you know, am I going to be forgotten about? And I never really felt that way. And I felt like they did a good job at putting out in real time what we felt like was the best protocol for the team first and then for the patients. And I never felt like I was rushed into anything. And they gave kind of, basically I had the option of kind of when and how I wanted to work. And so I felt like it was fully supported.
So what does it look like right now in the office or even right when you came back? Did things change, processes of like accepting patients or when patients would come in the office?
Yeah, I mean, I think, you know, like everybody, we're just trying to figure out kind of what a new normal looks like a little bit. So there was growth in trying to figure out what systems were going to work. So in terms of, you know, having, you know, face shields and, you know, proper PPE and, you know, measuring patients' temperature at the door and, you know, spacing out the lobby and having people wait in their car. I mean, it's things that most dentists are probably doing. But it was able to be rolled out, I think, a lot quicker because of the support that we have. And, you know, I think there's a lot of things that, I mean, we're pretty much back to normal. I mean, some of our PPE procedures are obviously different, and just making sure that, you know, everybody is following, you know, proper protocols. Not that you weren't before, but you're just more in tune with it and just, you know, having people and patients feel safe is very important. So I think Aspen did a good job. I mean, I felt fully supported, you know, in whatever change was happening because a lot of it we're just figuring out on the fly, right? Just like everybody
Yeah.
else. Like, are we going to be open tomorrow? Or are they shutting us down or whatever? You know, so it was a little wild there for a minute.
Yeah, and just so people know, you know, we were actually the second largest purchaser of PPE
Yeah.
for like with Henry Schein, like because of the ability and the access we have to Henry Schein next to the US government. So that just shows like just the capability of like how big Aspen is and um, the capability of our network to have the ability to get that much PPE and not really ever have to worry about running out or anything like that. So I don't think many of our offices or any of our offices really had to worry about what's the next step with PPE or with COVID.
Totally.
Oops, I just muted myself. um, so with COVID, were you doing teledentistry at all? Do you know of anyone that was doing teledentistry? Or was that just like not a thing?
We were going to roll it out. So I think that decision was kind of on, again, I keep reverting back to Dr. Miller and the ownership, but really Aspen's, you know, their best when the owners are basically running their practices how they see fit. I mean, there are certain things Aspen will recommend, and different things. Even with COVID, like there was recommendations I think from the ownership level, having all the owners go to these virtual meetings and decide certain things. And but Dr. Miller basically had full control as to what he wanted to do, when he wanted to do it, and how he wanted his team of doctors to kind of move forward. So he was kind of my point man when it came to a lot of that stuff. But I did not do any teledentistry because by the time we were getting rolled up, we were pretty much back to emergencies only. So we were seeing, people in limited hours for the whole month of May, a couple days a week, just for emergencies and simple stuff and diagnosis and stuff like that. So we were pretty much doing sort of teledentistry, although a lot of it was in person, but we did not end up rolling out the whole program that was planned because things changed so quickly in the other way where we were going to be opening on June 1st. And so it didn't make sense to do that because then we were back up and running. So
Right. With COVID, do you feel like your office isn't as busy now? Do you feel like there's lacking in compensation?
Visit my office. It is busy. We are slammed. I mean, there was a lot of people in pain, and being closed for 6 weeks was not fun. I mean, it wasn't fun actually, I enjoyed it. I had bought a house, and so I had to do a lot of yard work and honeydew projects. So I was busy, but yeah, no, people, we've had more demand than ever. I think, our last 3 months have probably been the busiest of the last calendar year. So
Wow.
in terms of are people not coming in, when your tooth hurts, you're going to figure it out. People, are like, they're very apt to make the phone call when they need dental work done. And that maybe you can speak to the Aspen patient, but a lot of our patients haven't seen a dentist in 5-10 years, and they got a lot going on, and they might have a couple of teeth that need root canals or that need extractions. And so I think COVID opened up a lot of people to dentistry of like, hey, I can't put off dental concerns this long, because when a dentist isn't open and you can't call them and your tooth hurts and you got to go to the emergency room and sit there for 5 hours,
Yeah.
I'm gonna go get my mouth figured out. And so I think it motivated a lot of people that maybe have been neglecting their oral health, and so it's been super busy.
Yep. No, of course, that's when it happens. When you're in pain, there's no dentist available.
Yeah, exactly.
But yeah, so a lot of our patients, it's kind of the way we've modeled Aspen. Our locations are in specific areas, because these are locations where we've found that there's patients that don't see the dentist often. They're later in age, they're in their 40s to 70s, 80s, haven't seen a dentist in a really long time. So it's kind of how our model works. We're trying to really serve the underserved. And so we put our locations in those areas so that we can provide the access that they don't have. But there are, certain locations, like Grand Rapids is a very popular area, but it's more on the west side of Michigan. So you tend to find more of those kind of patients. So it's a lot of strategy. But yeah, with COVID, I'm sure it brought upon more patients that really needed help during a time where a lot of people weren't open. So
Totally.
yeah. So this will be my last question. It's more of a non-dental. I don't know if it would be a fun question, but it's non-dental. But if COVID didn't happen, what would your summer have looked like? Or what will be the first thing you do when you have full freedom from COVID?
Full freedom from COVID. Well, okay. Well, I'm gonna have a son in February, so my life's gonna change anyway. So we'll see. I think my days of total freedom are gone, in a good way. So I would say, I mean, me and my wife love to travel. We love to be outdoors and hike. And the Army brought me all over the world, which is pretty cool. And so I got to stay and live on the west side of the country in Washington. So I had a lot of kind of hiking trips and things like that were kind of on our list that we're not, obviously able to because of COVID and the travel restrictions. So traveling, getting away from, dentistry is great. I love it. I love showing up. I don't take a lot of sick days or vacation time, but, I think that self-care is really important too, if not getting you caught up in the job part of it where you can't enjoy life too on the outside. And so there's a lot of cool people in Aspen that you connect with outside of dentistry, and some of these opportunities to go hang out with other doctors and just get to know their story, and go to these CEs and talk to people your age who are doing the same things. And I think that part is really cool. So for me, I will probably be trying to ski this winter if I can get out west, and then set up some other traveling opportunities. And Michigan's beautiful, I love it, but winters are cold, right? So
I was gonna say not up north. You're not gonna go up north and
I
ski.
will go up north, but it's not really a real mountain. I mean,
I know.
funny hill. So
That's awesome. Well, wonderful. I don't know if you wanted to have any closing remarks for the students, any last words, but if not, we'll conclude this session. I don't know if Dr. Vanderbont, if not, totally.
yeah, I will. I mean, I'm open anytime. Like you said before, if you guys want to come hang out, and shadowing sounds so dumb. I mean, I've been through it. I shadowed. It's like you can come hang out. You can shadow if you want it to be formal. I'm not very formal, so like I'd be happy to show you what a day looks like at Aspen. Come check it out. I mean, I think without seeing it in action, it's you can just hear about it, but I'm a visual experienced guy, right? So I like the experiences. So I never really, before I got hired at Aspen, I had actually never been in and really done anything with Aspen or knew much about them. So that was a little different for me. So I would say check it out. Come to Grand Rapids if you want. If you live in Michigan and you want to come hang out for a day or two, like whatever you want, you can see me do my thing. And I'll give you my cell phone number. Anyone who's here, if you want to send them an email, you can give them my cell phone. They can text me anytime, call me anytime. You got questions you want to ask just with me, that's fine. Or if
Yeah.
you just want somebody as a resource, I'm here for anybody.
Wonderful. Thank you so much. So I just want to thank you, Dr. Vanderbond, for attending the session. And then, of course, anyone that is viewing this, thank you so much for attending. And any future viewers on YouTube that see this, thank you for watching. And again, you should have my contact information. And feel free to email me regarding anything, and I will connect you with Dr. Vanderbond, and we can figure something out when it comes to shadowing or just any questions you might have. So everyone have a good evening, and thank you.
Awesome. Thanks, guys.
Bye.
Yeah.